It's a pleasure to be with you. The title of this session is Organization and Financing of Public Health, Part 8, U.S. Public Health Service and DHHS Human Service Agencies. There are no disclosures for this presentation. Objectives include review 7 of the 9 divisions that make up the U.S. Public Health Service, review the 3 divisions of the DHHS Human Service Agencies, review the 4 main programs of the Centers for Medicaid and Medicare Services, CMS, review other federal agencies and departments that have important public health roles. The last 4 sessions briefly reviewed several Centers for Disease Control and Prevention centers, including the National Institute for Occupational Safety and Health, NIOSH, along with the Department of Health and Human Services, DHHS, Agency for Toxic Substances and Disease Registry, ATSDR. The CDC and ATSDR are 2 of the 9 divisions in the Department of Health and Human Services that make up the United States Public Health Service. We will now briefly consider the 3 divisions of the DHHS Human Service Agencies and the other 7 divisions of the U.S. Public Health Service that support the broad mission of public health. Let's start with the Centers for Medicaid and Medicare Services, CMS. CMS administers the largest insurance programs in the country. The CMS 2022 budget was approximately $1.4 trillion. CMS administers Medicare, Medicaid, the Children's Health Insurance Program, CHIP, and the Center for Consumer Information and Insurance Oversight, CCIIO. Medicare provides publicly financed health insurance for elderly and disabled Americans. Medicaid is a program administered jointly by the federal government and the states, which provides publicly financed health coverage for low-income persons and nursing home coverage for low-income elderly adults. Although primarily considered a healthcare insurance program for low-income people, Medicaid reimbursed services also include such public health activities as early and periodic screening, diagnostic, and treatment, EPSDT services for children, family planning services, cancer screening, school health services, and adult immunizations. Further, Medicaid payments also support public health providers, such as health centers, public hospitals, community mental health providers, and STD clinics, which are dependent on Medicaid revenues to sustain their operations. CMS also administers the Children's Health Insurance Program, CHIP, which insures children from low-income families who earn too much to qualify for Medicaid. Each state develops its own rules regarding CHIP family income eligibility. The Center for Consumer Information and Insurance Oversight, CCIIO, helps implement the Affordable Care Act, ACA, by assuring insurance companies meet ACA provision requirements and works with states to expand new health insurance marketplaces. Let's now discuss the roles of the Administration for Children and Families and the Administration for Community Living. The Administration for Children and Families, ACF, works in partnership with states and communities to provide critical assistance to vulnerable families. helping find safe and supportive homes for abused children, provide counseling for newly arrived refugees, and provide support for homeless teens. In 2022, the ACF budget was $62 billion, the second largest budget in the DHHS. Examples of programs administered by the ACF include temporary assistance for needy families, TANF, Head Start, foster care, child care and development, child support enforcement, low-income home energy assistance program, LIHEAP, social services block grant, and refugee and entrant assistance. The Administration for Community Living, ACL, was created in 2012 and essentially merged the work of three programs: the Administration on Aging, the Office on Disability, and the Administration on Intellectual and Developmental Disabilities, AIDD. ACL focuses on providing the option for elders and people with disabilities to live at home and fully participate in their communities. Let's now consider the 7 other divisions of the U.S. Public Health Service that are bolded in white. Let's consider the National Institutes of Health, NIH, for a few minutes. The National Institutes of Health, NIH, is comprised of 27 institutes and centers that focus on conducting and supporting biomedical research into the causes, treatment, cure, and prevention of a broad range of diseases. NIH institutes and centers include the National Cancer Institute, National Heart, Lung, and Blood Institute, National Institute on Aging, National Human Genome Research Institute, National Center for Complementary and Integrative Health, and the National Center for Advancing Translational Sciences. In addition to conducting and supporting research, the institutes and centers also provide training for health and science professionals and the public. The NIH also includes the National Library of Medicine, which is the world's largest biomedical library, an incredible resource for health professionals, including public health, scientists, and the public. Its web-based databases include PubMed, Medline, and Medline Plus. The NIH and the National Library of Medicine provide a wealth of information for the practice of public health. Let's now consider the Food and Drug Administration, FDA. The FDA is responsible for protecting and promoting public health through the control and supervision of food safety, tobacco products, caffeine products, dietary supplements, prescription, and over-the-counter pharmaceutical drugs, medications, vaccines, biopharmaceuticals, blood transfusions, medical devices, electromagnetic radiation emitting devices, EREDs, cosmetics, animal foods, and feed and veterinary products. The FDA enforces the Federal Food, Drug, and Cosmetic Act, along with other laws and regulations like Section 361 of the Public Health Service Act. Let's next consider the Health Resources and Service Administration, HRSA, for a few minutes. The Health Resources and Services Administration, HRSA, provides equitable access to quality health care for the nation's highest need communities, serving geographically isolated and economically or medically vulnerable people, including low-income individuals and families, people with HIV/AIDS, pregnant women, children, parents, rural communities, transplant patients, and other communities in need. HRSA also supports the health workforce, health systems, and facilities that care for these vulnerable groups. HRSA programs provide healthcare access to over 30 million people in underserved communities with primary healthcare services regardless of ability to pay through the approximately 14,000 sites overseen by the HRSA Community Healthcare Center program and providing care to over 58 million pregnant women, infants, and children in the U.S. Almost 3.7 million infants, or nearly every newborn in the country, received newborn screening for genetic and metabolic conditions like cystic fibrosis, thyroid disease, sickle cell, and immunodeficiency conditions through HRSA-administered maternal and child health programs. HRSA also provides care to more than 89% of people living with HIV in the U.S. through the Ryan White HIV/AIDS program and administers programs that provide treatment for opioid use disorders, home visits by nurses, social workers, and healthcare counselors for families living in high-risk communities to improve health and child school readiness and emotional support and resources through programs like the Maternal Mental Health Hotline. Let's now consider the Indian Health Service, IHS, for a few minutes. The Indian Health Service is the principal federal agency within the Department of Health and Human Services, assigned the responsibility for providing accessible and available health services to American Indians and Alaska Natives. The IHS was established through government-to-government agreements that were established in 1787 between the federal government and Indian tribes, based on Article 1, Section 8 of the Constitution, and has been adjusted by several treaties, laws, Supreme Court decisions, and executive orders. The mission of the IHS is to improve the physical, mental, social, and spiritual health of American Indians and Alaska Natives through partnerships and culturally responsive practices. As of 2017, the IHS provided health care in 37 states to approximately 2.2 million out of 3.7 million American Indians and Alaska Natives through 26 hospitals, 59 health centers, 32 health stations, and 33 urban Indian health projects or facilities. Many tribes also operate health systems independent of IHS through implementation of Public Law 93-638, under which the employees and administrative control of an otherwise federal program, for example, the Indian Health Service, are transferred to the tribe government via a 638 contract. IHS also provides scholarship support to students pursuing medical education to help staff Indian health programs. Let's now consider the Agency for Healthcare Research and Quality, AHRQ, for a few minutes. The Agency for Healthcare Research and Quality, AHRQ, is the lead federal agency charged with improving the quality, safety, efficiency, and effectiveness of healthcare for all Americans. It does not make policy, but rather, with a budget of approximately $455 million in fiscal year 2022, AHRQ conducts and supports a broad range of health services research within research institutions, hospitals, and healthcare systems that informs and enhances decision-making and healthcare policy, and improves healthcare services, organization, and financing. AHRQ research focuses on clinical services provided, patient safety, health information technology, prevention, chronic care management, and fiscal values. Important data tools developed by AHRQ include the Healthcare Cost and Utilization Project, HCUP, the Consumer Assessment of Healthcare Providers and Systems, and the Medical Expenditure Panel Survey, MEPS. Let's now consider the Substance Abuse and Mental Health Services Administration, SAMHSA, for a few minutes. The Substance Abuse and Mental Health Services Administration, SAMHSA, is the agency that leads public health efforts to advance the behavioral health of the nation and to improve the lives of individuals living with mental and substance use disorders and their families. The 2023 to 2026 SAMHSA strategic plan identified 5 priority areas to better meet the behavioral health needs of the United States, including 1. Preventing substance use and overdose. 2. Enhancing access to suicide prevention and mental health services. 3. Promoting resilience and emotional health for children, youth, and families. 4. Integrating behavioral and physical health care. And 5. Strengthening the behavioral health workforce. Let's now consider the Administration for Strategic Preparedness and Response, ASPR. The Administration for Strategic Preparedness and Response, ASPR, focuses on preventing, preparing for, and responding to the adverse health effects of public health emergencies and disasters. Under the Pandemic and All Hazards Preparedness Act of 2006 and 2013, PAPA, DHHS was designated the lead agency for the National Response Framework, NRF, for Emergency Support Function 8, ESF 8. The Secretary of DHHS delegates ASPR to lead all health and medical services support functions in a health emergency or public health event. Its functions include preparedness planning and response, building federal emergency medical operational capabilities, countermeasures research, advanced development and procurement, and grants to strengthen the capabilities of hospitals and healthcare systems in public health emergencies and medical disasters. The office provides federal support, including medical professionals, through ASPR's National Disaster Medical System to augment state and local capabilities during an emergency or disaster. ASPR oversees the Strategic National Stockpile, SNS, the United States National Repository of antibiotics, vaccines, chemical antidotes, antitoxins, and other critical medical supplies, such as respirators, infusion pumps, cots, bandages, etc. The Strategic National Stockpile's role is to supplement state and local supplies during public health emergencies. Many states have products stockpiled as well. The supplies, medicines, and devices for life-saving care contained in the stockpile can be used as a short-term stopgap buffer when the immediate supply of adequate amounts of these materials may not be immediately available. Other federal agencies and departments that have important public health roles include the U.S. Department of Agriculture, USDA, Environmental Protection Agency, EPA, U.S. Department of Labor, DOL, the Department of Veterans Affairs, VA, and the Department of Defense, DoD. Let's consider their roles for a few minutes. The U.S. Department of Agriculture, USDA, plays a vital regulatory support role for public health through its Food Safety and Inspection Service that assures food safety and labeling of commercial beef, poultry, and egg products. The USDA oversees funding of food assistance through its Food and Nutrition Service, including programs like the Supplemental Nutrition Assistance Program, SNAP, formerly known as the Food Stamp Program, which subsidizes food purchases for low-income individuals. The National School Lunch Program, which provides subsidies to schools providing lunches that meet federal nutritional requirements and offer free or reduced price lunches to eligible children, and the Women, Infants, and Children Program, WIC, which provides federal grants to states for supplemental foods, health care referrals, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to age 5 who are found to be at nutritional risk. In 2022, participants for these programs were estimated at 45.4 million per month for SNAP, 30 million per day for the National School Lunch Program, and 6.4 million per month for WIC. The 2022 budget extended coverage to include child care centers and expanded the Summer Electronic Benefit Transfer EBT program, which provides food for school-aged children during the summer. The mission of the United States Environmental Protection Agency, EPA, is to protect human health and the environment by regulating the release of pollutants in the air, land, and water, and conducting or providing grants for environmental remediation. Nearly half of the EPA's budget is expended through grants to states, nonprofits, educational institutions, and others for a variety of projects ranging from scientific studies to site cleanups. EPA grant categories include air, radiation, water, drinking water, hazardous waste, pesticides, and toxins. EPA implemented laws include the Clean Air Act, the Clean Water Act, the Comprehensive Environmental Response, Compensation, and Liability Act, the Safe Drinking Water Act, and the Toxic Substances Control Act. The U.S. Department of Labor, DOL, Occupational Safety and Health Administration, OSHA, regulates the health and safety of workplaces, either directly or through approval of state occupational safety programs that meet federal requirements. OSHA regulations are based on the CDC's National Institute for Occupational Safety and Health, NIOSH, research and recommendations. The DOL also administers the Bureau of Labor Statistics, BLS, which collects, analyzes, and disseminates American worker data, including demographic, occupation, and industry-related earnings, worker characteristics, employment information, labor turnover, and consumer expenditures. The Department of Veteran Affairs, VA, and the Department of Defense, DoD, provide healthcare services to veterans and active military personnel. The VA operates the nation's largest integrated healthcare system, providing care at 1,298 healthcare facilities, including 171 medical centers and 1,113 outpatient clinics. The VA healthcare system serves approximately 9 million enrolled veterans each year. In summary, the U.S. Public Health Service consists of 9 divisions within the Department of Health and Human Services. CMS administers the largest insurance programs in the country. Medicaid provides publicly financed health coverage for low-income persons and nursing home coverage for low-income elderly adults. The Children's Health Insurance Program, CHIP, insures children from low-income families who earn too much to qualify for Medicaid. The Administration for Children and Families administers the Temporary Assistance for Needy Families, TANF, and Head Start programs. The National Institutes of Health, NIH, conducts and supports biomedical research. The Human Resources and Services Administration, HRSA, supports the health workforce, health systems, and facilities that care for vulnerable groups. The Administration for Strategic Preparedness and Response, ASPR, focuses on preventing, preparing for, and responding to public health emergencies and disasters.